Good afternoon, everybody. I want to briefly talk about the um, great discoveries that we've made, the good progress that we've made with respect to the issue of erectile dysfunction and premature ejaculation. The reason why this topic is very important is because there was or there is an increase at the rate at which this issue is affecting individuals. Before now, we used to see these diseases commonly among the elderly men, but today it's not only the disease for the elderly, but for also common among young people. And imagine a situation whereby somebody just got married and is expecting to impregnate the wife, and this disease sets in. You will see that it will become of great concern. And one thing about this disease is that it does not only affect people physiologically but also psychologically. It causes a lot of embarrassment. As a result of that, some marriages has broken up because of this case. So it only takes the grace of God and a heart of understanding for a partner, I'm talking about the female partner now, to cope in such a challenging time, why the husband or she aid the husband in looking for a solution. It's a problem, and every problem has a solution. I thank God that we did a great research. We did a literature review with respect to this issue, and we were able to find reasonable and reliable management procedures, which I thank God that is working. It is working for us today, and everyone that who has taken our line of therapy or treatment for this management, they have been coming back to say, at least to say thank you for what you did for me. And that is actually our aim. That is where our satisfaction comes. It's not just in the making of the money. We might not be making the money now, but what we really want is for our patients to be satisfied. What we really want is for them to, get a solution to their problems. And we thank God that gradually we are achieving that. Now, I want to briefly talk about the, in medical term we call it the etiology, which is the study of the cause, etiology of erectile dysfunction. Now, the cause of erectile dysfunction is still it's not something that is still very straightforward with respect to the pathophysiology, but it can be attributed to different kind of causes. Number one that I want to talk about is stress. Stress is one of the factor to be considered when somebody is having when somebody begin to develop erectile dysfunction. I'm not talking about only oxidative stress, I'm also talking about mental stress, because coitus or engaging in a sexual relationship has to do with both the mind, especially the mind. It is more or less more psychological than physiological. So the mind must be made up to engage in it, and it is also the function of the mind to predetermine how the person wants to perform, and the person should believe that yes, I can perform according to what my mind is telling me. That is why one of the line of actions that we looked into is a medication or a medicine that affects the mind, that relaxes the mind, reduces anxiety. It's one of those drugs that we looked at. But that drug, it has a dual purpose. We didn't just pick it because it reduces anxiety. We picked it because it delays ejaculation. Yes, for a reasonable time frame, to enable the woman come to the climax of her orgasm for a satisfactory sexual relationship. So that is for stress. So men, you need to look at your nature of job as a man. How stressful is your job? If your job is a very stressful one, then you need to be placed on an antioxidant because of oxidative stress. There are many things that stress does in the body actually. Stress can increase the tendency of aging. There are many things it does on the body. It can cause injuries around the body system, especially among the vital organs, which the heart and the brain are part of those vital organs. So stress management is one of the procedure in managing erectile dysfunction. Then we talked about, I've already thrown a light about anxiety. Yes, anxiety management is also another procedure in managing erectile dysfunction. Then also we looked at hormonal imbalance. Hormonal imbalance among men is also becoming common, which can also be responsible for erectile dysfunction. So we looked at that area too, and we were able to uh, see how it causes it. There are hormones in the body which are called the, the secondary sexual hormones, which are produced in the body once somebody enters the age of puberty. For men, produces testosterone, they produces androgen, and also they produces progesterone. And when any of these hormones are insufficient, it will affect the person's performance. So in managing this situation, we also refer people to the lab where they go for a proper checkup of their hormonal profile for us to know the hormone that has gone down, and that will enable us to treat the hormonal imbalance. There is what is called HRT, hormonal replacement therapy. So it's also one of the treatment procedure for erectile dysfunction, hormonal replacement therapy. And also there are some neurotransmitters in the body. Neurotransmitters, they are like messengers. The way blood vessel carries blood around the body, that is how the nerve works with the neurotransmitters. So the nerve sends messages or signal around the body, which is called the nervous system. And in the nervous system we have the central nervous system and the peripheral nervous system. The central nervous system comprises of the brain and the spinal cord, while the peripheral nervous system comprises of all the nerves around the body that are joined to the brain and the spinal cord. So the neurotransmitters, their work is actually they work in a kind of sending a message to the brain and other parts of the body. For example, if a particular hormone is high, the nerves around that area will send a message through the neurotransmitter to the brain, signaling the brain that so and so hormone is high. So the brain will send a message back to the part of the body that produces that hormones to stop producing, because there is already too much of the hormone in the blood. And these things, they happen very fast. In the twinkle of an eye, they happen very fast. So such feedback mechanism is also what we looked at. Because when we discovered that some hormones can either cause erectile dysfunction or premature ejaculation, we have to put those hormones into consideration. For example, excess of phosphodiesterase 5 in the blood can lead to erectile dysfunction. It can lead to weak erection, an erection that cannot be able to sustain coitus. That is sex. The medical name of sex is called coitus. So what did we do? We exploited drugs that can inhibit the excess production of phosphodiesterase 5 neurotransmitters. We considered the drugs which can inhibit them, and it is also one of the drugs that we're using for the management of erectile dysfunction and premature ejaculation. So sometimes too, bacterial infections can cause this issue. And it's unfortunate that most people, they look more at that angle of bacterial infection. But it is not right to just assume that your problem is caused by a bacteria, a particular type of bacteria, thereby going for self-medication, maybe going for a herbal concoction. Because we also look at our society today, you see people who come up with claims. I don't know the content of those things that they carry around, claiming that they are herbal medicine for treating this or that. In fact, it is very unreasonable how they give one particular concoction so much claim. I will tell you that it can cure high blood pressure, it can cure sugar, it can cure rheumatoid arthritis, it can cure pain, it can cure typhoid, it can cure malaria, just one concoction. And something that should let you know that what they are saying is actually unreasonable is because most of these things they are calling, most of the name of the diseases they are calling, they are not related. Some of them are infectious diseases, while some of them are non-infectious diseases. So the way a disease is caused gives us information on how to treat the disease, the way a disease is caused. So do not just assume that your problem is being caused by bacterial infection, thereby subjecting yourself to these dirty things that you are carrying about. I'm not saying that there are no good herbal medicines, but you must confirm that it is good before taking it, not just because of what you heard on the speaker or what you heard in the public place or what somebody told you, somebody whom you don't even know his level of knowledge in medical practice. Some of them, they are not even clinicians. They are just people who are going about looking for money, and so they use that as a source of livelihood, so they can say anything in order to convince somebody to buy what they are carrying about. So we also send people to the lab to check whether their problem is being caused by a bacterial infection. And when it is caused by a bacterial infection, we swiftly treat the bacterial infection. And we thank God that most of the bacterial infection that causes this issue, they are treatable. And we have good antibiotics which can be used to treat this issue. We have them, and the lab results also gives us information on the antibiotics of sensitivity, which can be used to tackle the bacteria which has been found in the man's body. So with what I've just said now, you see, it's a kind of it's not a complex process. It's actually a very simple process that is working. It is working. That is my source of happiness, and that is why I'm making this video, because I've made a video concerning erectile dysfunction before, but somehow the video got corrupted and I couldn't produce it and send it across. But I thank God that we now have a procedure that is working, and we want each and every one of us, or if you know that this is an issue with you, Don't feel ashamed. Just come up, meet us, consult us. We will discuss about it. We will send you for tests to know what the problem is, and we hit the nail at the head. Yes, we hit the nail at the head. It is actually working. Then another cause again, there are also some diseases which has erectile dysfunction as a secondary disease. It means that there is a primary disease which has erectile dysfunction as a secondary disease. Example of that is high blood sugar level. High blood sugar level has erectile dysfunction as a secondary disease. Also, a high level of cholesterol in the blood, which causes the blood vessels it influences the rate at which the blood vessels move blood around the body, because those fatty substances, they will go and plug the blood vessels, thereby preventing blood from getting to the area. Blood is what carries oxygen and nutrient around the body, so preventing blood from getting to the penile area. And the blood vessels around the penile area, once they don't have enough blood, there cannot be an erection. Erection cannot come up, because erection comes up when there is an influx of blood to the penile blood vessels, oxygenated blood, and then nutrient-filled blood. So, from what I've just said, I think it is self-explanatory. I've mentioned almost the categories of drugs that are used for the management of this erectile dysfunction. We talked about the antioxidant for stress. We talked about the anti-anxiety drugs. We chose the selective serotonin reuptake inhibitors because they gave us, that particular group of drug gave us a good result with respect to calming of the heart, calming of anxiety, and it also extends ejaculation. So that the person cannot suffer premature ejaculation. And we talked about also the hormonal balance, hormonal replacement therapy medications. There are many of them. Depending on the one that is lacking in your body, that will give us the information on what we're going to use to treat or tackle the issue. Then we also talk about the drugs that influences the neurotransmitters. Some of them, they can cause polarization, depolarization, and hyperpolarization. These are just medical terms, so I don't want to bother us with many medical jargons, but I just want you to understand that we have a very good procedure with respect to this issue, and we are doing well with it. We are seeing good results, and we advise you to come up, just come and meet us at Advanced Healthcare Pharmacy, and you will join the number of people who are happy. Many of them, they are happy, their marriage is stable again. The happiness alone that they come, with which they come back to us to say thank you. You will just know that this person is feeling well. And we've been gotten a lot of recommendations. People have been calling us from different parts of the nation, to even outside, to like people who other people refer to us thank God for that, and we look forward to hearing from you. It might not affect you directly, but maybe you know somebody who it's affecting. We advise you to invite the people. You can bring them. You can send us their numbers. We will put them on the forum so that they can also get this information for themselves and engage in its management. So, having said that, I wish you well, and I wish you a strong health, and I wish you more of God's blessings. I will continue to talk about erectile dysfunction with respect to different diseases that has it as a secondary disease. I will continue to talk about it, but for now I want to end this video here because I just wanted to explain to us that we've gotten a therapeutic procedure that is working. Thank you, and God bless you. Amen.